This is my name. So thank you for waiting to the end of the day for this. I know it's been a long day, and somehow I feel this is like a tipping point in my own career. I seeing all of you and hearing of your interests and your, it reminds me of not that long ago where I was sitting in the same seat thinking about the same things. And to be given the opportunity to talk about my career and some thoughts, I think to me it feels right. It's the right time. And it's why I flew over here to do this. I met Pia, who spent some of her summer in my department last year. And when she asked me to come, I was excited to have this opportunity. And because we don't have opportunities like this, talk to young people as often. And she actually helped me get Hamilton tickets, which is even a better reason. She's the one. You can ask her. She knows how to get tickets. So it was a great show. So I thought I'd play a little video to start. It's not working. Oh.
Is the universal law international?
I'm a brain surgeon. Big difference.
All right, so hold on, this is really going well. So I'll start over. So this is from the BBC. I swear this is a British video, okay? So I wanted to start off with a disaster that I had. That I wrote this probably just in 2014, October 2014. I wrote this. And it was an experience that I've always, like you guys, you want to be the best you can be, you think you train hard, and just when you think you're sort of there, you have something happens and it changes your perspective. I was operating on a woman, about a 40-year-old woman for an unruptured aneurysm, which is, these are usually very safe operations. And I lost control of the aneurysm it just started to bleed after I put the clip on it. And I had no control. The brain was swelling out of her head. I thought she was going to die. And when we're in these situations as surgeons, whether it's neurosurgery or cardiac surgery, or any place where you feel like you're actually hurting someone, I think earlier on in my career, wouldn't react the same way. There's certainly a horror aspect to this, but for whatever reason, I started thinking about her family, what I was going to tell the family, how I was going to get out of this mess. And so this was a very, very searing experience for me. And in the end, it made me stronger and better. The patient ended up surviving. She ended up having a modest stroke and needed rehab. And she's I wouldn't call her disabled. It was in the right frontal lobe, so she actually made a very reasonable recovery. But she's not the same person that she was. And yet, I have to live with that. I have to live with the aspect that I've hurt someone. And I think that causing strokes is probably the worst thing you can do. My father had a stroke. It's one of the reasons why I became a neurosurgeon. And seeing what stroke does to people was one of the reasons why I basically do what I do. But in the end, I think that the reason I start off with this is to remind us that we're human beings, our patients are human beings, and that your life, if you choose to do this, you've already chosen to be a doctor, that you can never forget why you're doing this. We talk about the competition or what I have to do to get ahead or my CV. That's fine. It's absolutely fine. But it doesn't take away from the essence of why you chose to do this in the first place. And try not to forget that. Because it's very easy to forget that what it takes to really achieve. And what are big achievements? Another aspect of achievement is failure. That failure is ultimately results in the greatest achievements. Do you know that Apollo 11 would not have probably landed the moon if it hadn't been for Apollo 1? Does anybody know what happened in Apollo 1? I'm a huge space junkie. Does anybody know what happened in Apollo 1? Where? What's that?
Just went off.
What blew up? Well, but they weren't even in the air. They were on the launch pad and they were practicing. They were going through rehearsal. It was a simulation of a launch, and they basically set the capsule on fire on the inside and only unlocked from the inside, not the outside. They couldn't get the pilots out. So these 3 guys died. And NASA shut the programmed down for a year, did a whole review, and they say that if they hadn't done that, they probably never would have gotten to the moon. Now I consider getting to the moon probably one of our greatest achievements, one of humans' greatest achievements, and it started with failure. And your careers you're gonna fail. You will. In fact, this is one of my favorite lines, my favorite set of words. Anybody know who said this? Someone who's very near and dear to the British, in fact. Winston Churchill, that's right. The point is that we are so driven personally to be successful by ourselves, by our parents, our ambition, where we think we're going, and then you forget what it takes to do that. And so in the end, I think my talk today is about how I've learned and how we not only need to learn to be our best, but how to innovate. Because without innovation, and without constantly trying to make ourselves better and our situation better, I think one of our other speakers said, you want to be the one who's figuring out how to make the change, not watching it happen or waiting for it to happen. That, I think, is maybe the biggest secret of being successful, not just in other people's eyes, but in your own. You're never going to be, if you're worried about what other people are thinking of you or worrying about being successful in other people's eyes, you're already behind the 8 ball. You have to be successful personally. This is an aneurysm clip. And I love neurosurgery from the minute I saw it. I love the sickness of the patients. I love the culture. I think my feeling is the way to decide what you want to do is pretty simple. You find somebody that you look at and say, I want to be like that person. It's without question the easiest way to help you decide what you should do with your life. Because if you can see someone doing something and behaving a certain way, and you can see yourself in that situation, it could be your dad, it could be your mom. That's why so many of us in medicine our parents are doctors, because we say, I want to be like them. But even when it comes to what kind of doctor I want to be, look around you, find a mentor, find someone who you respect, who talks your language, you can be honest with, or be honest with you. It doesn't have to be the chairman of anything. But once you find that person, that's what helps you find your aneurysm clip. And what was interesting about this is where the story just begins, is that there are many technologies that have come out over the years. Aneurysm clips being the thing that allows us to clip aneurysm safely. The operating microscope, which is one of the most elegant, beautiful machines in medicine, to look through an operating microscope and to see the magnification, the beauty of the brain, or whatever it is that you're operating on. ENT surgeons use the operating microscope, plastic surgeons. When you start to see and just get that feeling is when you get charged up and you get excited about doing these things. I could never have been an internal medicine doctor. There's just no way. I thought I would be a cardiologist, and I just couldn't, I didn't like the pimping and the way people were trying to prove one was better than the other one, somebody was smarter than the other one. Did you see that was in my note? I was like, I don't care what's in your note, what's happening with the patient? And the thing is about surgery, it just seems like it was more of a team. People were trying to help each other. There was an excitement about getting patients and getting cases as opposed to getting hits out of the ER. And the operating microscope, to me, was this phenomenal tool. And the reason why I'm talking much about the scope is I'm going to loop this back about innovation towards the end of the talk. So I had this aneurysm clip thing going. I had this microscope thing going. And then suddenly the world changed. Thomas Kuhn was the originator of the concept of what's called paradigm shift. And a paradigm shift it probably will occur in your lifetime. It's something you're doing. It's when everything changes. When what you thought yesterday was normal and was the right answer, suddenly it changes. And sometimes if you're caught on the wrong side of that, it can affect what you do every day. It can affect your career. It can affect a skill set you had. In fact, if you were making Hummers in 2005, and all of a sudden electric cars come out, your business gets blown up. When the economy tanked in the United States and all the car companies went bankrupt because they were poorly designed or weren't making good cars, all of a sudden the whole way to making cars changed. It can happen in healthcare. It happened to me. So all that great stuff about aneurysm clips and microscopes changed, because when I first came to New York City, this is a map of the New York City area Those 3 red dots are the 3 places that treated aneurysms in New York City in 1998. And then by the time 2018 hit, one major paradigm shift occurred with the treatment of stroke. And the government incentivized stroke treatment. Strokes are treated with catheters, not open heads. And it turns out that when you have a catheter in your hand, you can also treat aneurysms with coils and stents. Well, that's great because you can treat this without opening heads. And guess what? Because the threshold to train and the threshold to be comfortable to treat aneurysms changed with catheters rather than open surgery, look what happened. How many places started treating aneurysms in 2018? Well, guess what? There weren't more aneurysms around. There were just more centers. And so the number of patients that I started seeing dramatically decreased. This is by 2018. So all of a sudden, this thing I love to do and train the most, I wasn't doing as much anymore. In fact, it was just getting harder and harder to get patients to come see me. And in fact, this new dawn, this new world was just happening all around me. I thought I'd been the best I could do. I was doing all the right things. I had the mentors. I set myself up. And now the whole world changed right then. So you have a choice. You know, what can you do? This is a great little video. So, you know, I felt like the sword guy. I spent all these years training how to be like, you know, I could take you down with, like, I put it behind my back. But if you have a gun, you don't need the sword anymore. And in fact, historically, if you look at little things which had massive impact on the world, the stirrup changed the way you could actually shoot an arrow. The knights of yore didn't have stirrups, and they had all this heavy armor, and they had a hard time staying on their horses. They couldn't fight and ride at the same time. Once you had stirrups, you could hold your body on and you could shoot your arrow, and that changed warfare. In Japan, there was no gunpowder when Western people went there, and they had the samurai. Totally radically altered the society when all of a sudden there were guns in Japan. In fact, in early Europe, when the gun came around, there were people who thought that wasn't a chivalrous way to fight, that wasn't the right way to kill people. That was because there was no chivalry in it. Well, you know how that all ended up. So you always have to innovate and be aware that you have risk. If you're always doing what you're most interested in doing, and you find a way, and you have an open mind, you'll be okay. So what I did is I went back, and 10 years into my, as a full attending, I went back and did a fellowship. And I learned how to put these stents and these coils and all these new devices that were coming out. And so that I felt that I could be the best I could be. I think there have been some discussion about these sorts of curves and things, but what I learned the second time around, I didn't learn the first, and I hope you listen to this, because when I was a medical student and intern, I thought I was just great. I worked hard, I was, really I always was working harder than everybody else, I thought, and I felt like I was a smart guy, and I did all the right things. But I never went through this very early stage in learning, or it took me a long time to get there, of this stage right here called consciously incompetent. One of the things about this 10,000-hour rule, and someone else brought up the concept of bullying, like what if I'm wrong, the key to your first step before you start doing anything as a surgeon is knowing you don't know anything. A lot of us enter into this unconscious incompetence phase where we just don't even realize how bad we are. And the truth is, when I went to Buffalo 10 years in, I started learning from the beginning, and the guy next to me was a fellow who was just out of his residency, and I was out of my residency 10 years. I was aware of how difficult it was to learn. I had more fear. I also didn't want to hurt someone as much. I had more responsibility to the patient. That all came from those 10 years of really being responsible to the patient. And here I was 10 years out of my residency, as opposed to the guy who was 1 year out. Massive difference. So I got to this stage much faster. The first step in your surgical training is getting to know what you don't know. Once you know what you don't know, you can get to becoming consciously competent. And there's truly world-class surgeons are unconsciously competent. That's when you're just, you can just show up and you know exactly, you're not thinking about every step. It goes from your cortex to your cerebellum. You're like, no. And it's not everything that we do that are like that. If you watch, athletes are like this, certain musicians. And these are stages of what are called flow. I can't pronounce Michele's last name, nor will I try, but he wrote a book called Flow. I would urge you all to read it. It's probably had the biggest impact. There are 2 books you should write down, 2 books with the biggest impact on my life as a thinking surgeon. It's the Wisdom of Crowds and Flow. And Flow is all about where you need to be as you're learning. When I was very early on, you're learning to put an IV in. It's a very low challenge, but it doesn't really take very much time. You can as long as you're can learn the competence piece. When you first tried, the first time you put an IV in, you were probably anxious because it was the challenge. Even though the challenge was low, you had 0 competence, and the amount of time it took to get there was pretty small. But this actually should say time, and this should say challenge. The more time that you spend doing something, and the higher the challenge, that's where you stay in your flow curve. If you're doing something that's too difficult for your competence, you're anxious. If you're doing something that's too easy for your competence, you're bored. And the key is to continually try to stay in that flow channel. You improve this by innovating, and you improve this by working harder and making yourself better, and also admitting what you don't know. And in doing so, you keep yourself in this flow channel, and you can expand the flow channel by mindfulness. Anxiety by not knowing yourself, by not understanding your own self-awareness, by being aware of what your true motivations are. You shrink that flow channel because everything freaks you out. So you have to be mindful. So there's grit to get over the anxiety. There's flow, which is from mindfulness partially. And then there's those 3 together, I think, are what are key to being successful surgeons. How do you innovate? Well, there's innovation everywhere. And what I said earlier, IT and what we have in our hands, these little computers in our pockets, are really reflective of what we can do and what humans can do with our external brains. And it's important to consider all these aspects of things when you think about innovation. You have to come up with an idea, you have to follow it through, you have to identify a problem, you have to have a routine, you have to plan for it, you have to be motivated, properly incentivized. And there's so many opportunities for innovation in healthcare. And my innovations, what I kind of got involved in was how to put vessels together. These are just 2 drawings from 2 publications of our groups. This is showing how to put those tiny vessels side to side, putting vessels together side to side rather than end to side. And this is a new kind of cerebral bypass. We're putting a conduit graft between an artery behind the cheek rather than going to the neck. And it just changed the way I thought about doing things. I think it's important to always recognize your mentors and the people that taught you. These are all the folks that have had impact on me over my lifetime and in my career. There continue to be more. Every one of them, and some of them were real jerks, to be honest. This guy in particular, Clam, forget about it. But you know what? There's not a day in the OR goes by where I don't think about it. I don't hear him saying something in my ear. Where I don't remember him saying something, reminding me of something. And I might have hated him, and he might have made me cry, and I would go home. But, you know, I think that I never could have done what I had done without him saying the things he did to me. So, going back to that microscope, this has led to my recent thing that I've been working on. You know, the operating theater hasn't changed that much if you think about it. This is Harvey Cushing, who is the father of American neurosurgery. You can see he's using this magnification. He's got a light in his head, and he's got, you know, some sort of glasses. I'm not sure if there's even magnifying glasses. So the microscope came around, and now we have these beautiful scopes, but this is the newest device that I wanted to tell you briefly about this innovation that I got involved with and how what happens is the more you expose yourself to being creative, it keeps you interested. You know, it doesn't mean that surgery's not interesting, and I'm in my mid-50s now, but, you know, it's nice to be constantly challenging yourself. And just when you get comfortable, the world can change. So keep your mind open. And I was asked to sort of help kind of trial this and get involved in this thing. And what this is, it's a 3D exoscope. It's basically a little video camera. It's about half the size of the conventional microscope. This is the entire thing. And what it does is the trouble with the microscope is you're looking through the scope, and so your head is always attached to the scope. So if you angle the scope, you have to turn your head or look over. And sometimes you're in these really difficult positions. Your neck can hurt. You know, you're always staring through this thing, and it can be exhausting. Also, the assistant has to look from the sides. The assistant's really in trouble because if I move my scope, the thing hits him in the eye. He's got to move around. He's got to be sitting or standing, depending on where it was. So you're forcing your head to be attached to an objective, and by removing the head away from it and looking at a 3D screen with 3D glasses, you're just sitting there and operating. It's almost you have like Superman eyes. Because I can sit there and I'm looking at a screen, I'm like, wow, that's interesting. And my assistant and everybody in the operating room can see exactly what I can see. So the microscope is ubiquitous right now. This is a brand new device that was just released. So if you go in any neurosurgical OR, we're all dependent on the microscope. And it's been around since the late 50s, really popularized in the 60s with adoption in the 80s. And there's all these new cool things that you can see through a microscope. But this is what the exoscope looks like. This is from a case we just did a few weeks ago. So you can see I'm wearing these 3D glasses. You can see where the screen is. It's very close to the surgeon, about 2 or 3 feet, maybe about 3 feet from the surgeon. But everybody sees what I see. Here's my fellow, here's the scrub tech. So everybody's seeing exactly the surgeon's view, and they can see the same perspective. So it's less painful. There's a smaller size, it's actually cheaper. There's great educational opportunity because a medical student can learn and understand what I'm seeing. Greater field, there are also some technical benefits to the scope. And there are some nuances to it. In other words, I have to make sure no one's in my way. If I'm going to have a microscope looking right through it, once you put the screen away from you, you have to change the way you organize your operating rooms. There's a certain amount of uncomfortableness. The tough part of innovating sometimes is you get out of your comfort zone. You kind of get away from what you're used to. And there's anxiety that comes from that. It's hard. It's easy just to go home and, watch TV, put the kids to sleep, get up the next morning, keep doing the same thing. But sometimes, getting yourself out of your comfort zone is fun. So these are what these videos, this is a 2D version. You can see the quality. This is 4D HD camera in this microscope. And this, you don't see a lumbar laminectomy very often in a meeting like any meetings because no one bothers recording this because it's too hard to do. There's no good way to record this because you're usually doing this with loops. You can wear a head camera, which isn't, so every time you move, the video moves. But this is what a lumbar laminectomy looks like. So basically the patient's on his stomach. He has a really nice tattoo on his back. His butt is down here. His head is up there. And this is L4-5. So I'm basically putting these retractors in. And you can imagine, I'm doing this entire operation watching this rather than looking through anything else. And it's just absolutely gorgeous and beautiful. When you see the great thing about these things is that I think students and people in the room begin to actually see the beauty of neuroanatomy. Here's what a dural looks like. So now I've got all that bone off. And this is just basically to give the nerve roots of the lumbar spine more room. You just have to remove some bone. But the beauty of this, it's hard to describe this, and if you've never seen it, you can't see, you're never going to be attracted to it. So you should all come to watch this stuff so you'll all be neurosurgeons, because I guarantee if you see this stuff through the scope, you'll absolutely be amazed. And no matter what operation you watch, you can become an ENT surgeon, a plastic surgeon. The minute you're watching it through in this way, you understand how exciting it is to be a surgeon and how gratifying it is. But this is what the plaque looks like inside a very tight carotid artery. And watch when it comes out, you'll see how beautiful the arterial wall is that's left. You can see the normal wall here, and what this disease looks like. But you could never have seen this before because no one does an endorectomy using an endoscope. And so now you can see what we're seeing. And you can say, wow, that's really cool. I'm going to try doing that. And it creates more surgeons when we close it. This is, you guys use 600A, this is 7.0 suture. So it's about the same size. Now my favorite thing to do in the whole world is a cerebral aneurysm. And this is a craniotomy. How many have seen a craniotomy? So now you've seen one. So this is a craniotomy through the scope. You never use a scope for a craniotomy because why would you? So here's the dura. See how beautiful the brain looks? And I never get tired of this. We never get tired of looking at the brain and looking at the blood vessels. Going back to, that's my biggest feeling of loss from all this intervention, all these devices, is I just don't do this every day. And you know, when you start thinking about what you should do in your career, you know, there is such a thing as balance, no question. You have time, you have to work that out in your mind about your family and your other things you love to do. But the truth is that if you're not happy with what you're doing, it's hard to have that balance. So you have to find what you love to do and stick to it. So I'm looking down the sylvian fissure here. There's the frontal lobe, there's the temporal lobe, and the middle cerebral vessels are in here. To orient you, the eye is here, the ear is here, the feet are up, the top of the head is down. It's a little tough to see this when you don't really know what you're looking at. What you'll see is that the skull base is the top of the orbit, and I'm going down and trying to find, the corridor to try to find this aneurysm. And we'll move it along a little bit because I want to show you what happens. So that's the optic nerve right there. So there are other great things about this. Here's a navigation. When in neurosurgery, we use navigation. This is the MRI over here, and this is the actual operation. When you're operating through the microscope, you can't see the screen because you're looking through the scope. So you have to keep looking around the microscope to where am I? Where's the navigation? So you just park the screens right next to each other. In fact, we're going to build in a picture, so your eyes can just shift back and forth and make that easier to do. You can use this as a light source. Here is a spine operation with the assistant's looking at the 3D, and the primary surgeon is just using this as a light source. It's really, really effective. And then, of course, medical students. People, we have this in New York, people just show up, they want to watch. And I think so this is a true innovation. I don't think Peter in this picture. And then we were in the New York Times last week because they, one of the writers, Denise Grady, who I know pretty well, came into the story on this as a true innovation. This is actually a cerebral bypass operation. You can see this is what it looks like and how absolutely beautiful this is. So in the end, innovation keeps you interested, it keeps your life exciting, it keeps you aware, and it decreases your risk. And the microscope's going to be very disruptive. It's going to improve lots of things in neurosurgery. And I'm lucky that I'm involved in it. But when you hear about something, go for it. If you see something that sounds new or exciting or unique, go for it. You can't fail, because you'll learn even from failure. Remember that. Never oh, maybe I shouldn't do this. What if it doesn't work? That's just, you will learn from it not working. Not everything results in a positive outcome. You know, this is a fighter pilot. I was in Israel. I gave a friend of his this hat, and he sent me this iPhone picture of himself with our Lennox Hill Neurosurgery hat. And life's a journey. Just crazy stuff happens. And I think that when you come right down to it, it's about teams. And it's not about you. You have to surround yourself with good people. You know, there's a book called Team of Teams by Stanley McChrystal, who was a general during the Iraq surge, who encountered the Al-Qaeda in a brand new way, and the Army really wasn't set up, the American Army wasn't set up to defeat a threat like that. He had to totally change the way these teams were built. He writes a great book, and Atul Gawande talks about this. He was mentioned before. He's at the Harvard School of Public Health. He's a surgeon at Brigham. He's a wonderful author. He's the one who came up with the checklist. His book, Checklist Manifesto, also a good book to read. But I think this quote, I think, is very true, that we've hired, trained, and rewarded physicians to be cowboys, when what we want is we want pit crews for our patients. And you have to make this transition. You have to worry about yourself right now. You have to get trained. You have to worry about where you're going to do your residency, your fellowship. That's how we're all built. But then when you get into the environment, you have to suddenly become bigger than that. You have to respect the people around you. You need new communication strategies. You must work together with other people. And you have to be collaborative. We're not really taught this in medical school. A team of teams is what we need. And the sooner you begin to develop teams around you, even at your stage, whether it's the way you learn now in medical school, I mean, look at this conference. Look at the people that work together to bring us together. Look at the success of this. You know, that's because they worked together. And because they knew who had roles and what everybody's roles were. It's very important to be flexible. And you have to work across silos and divisions. That a success in a complex world, and trust me, hospitals getting, if anything, more complex requires this. That you have to shift. And you have to be aware of the people around you. You have to have tremendous empathy. You have to have humility. And you have to have tremendous self-awareness. There are no courses on this in medical school. And until there are, it's going to be up to you to develop these skill sets for yourself. So you have to embrace it. The sooner you embrace it, the sooner you know that you're constantly incompetent and that you're working hard to get there, you're willing to put the time in, you're humble, resilient, the more successful you'll be no matter what. These are two basketball teams. There's a big difference between the two. They're both dream teams. This is the Olympic basketball team from 1992. Probably the best team the United States has ever had in the Olympics. This is the basketball team from 2004. LeBron James on this team, Allen Iverson, Tim Duncan. These guys there's many Hall of Famers almost on this team. This team won the gold medal. This team didn't medal. And why was that? It's because they didn't work together. That individuals don't do it. This is my team in New York. I even took my shoes off, by the way. I thought it would be bad idea to have a cigarette in my hand if you're familiar with the Abbey Road picture, but you have to have fun. Surround yourself with people you can have fun with. Find those people that are attracted to you. That'll you'll be attracted back. And it works. It's not as one-to-one. It's not like getting a test back, or your scores back, or being told how wonderful you are. But trust me when I tell you, if you're built correctly, the gratification you get from surrounding yourself with these things and being successful as a group is far and away more fun and gives you so much more than when you go home at night than just working for yourself all the time. And then I think that this is a giant aneurysm in a woman that I operated on. But this isn't who this is not what that is. This is who the person is. That the success of treating that aneurysm is for her and her husband, and it required a group of people. It wasn't just me. And everything you do as a surgeon is based on that. When I first went to Lenox Hill Hospital, and I left my other one job, and I was asked to start a department up at Lenox Hill. And I remember getting there, and I was the same surgeon in 2013 that I am now. But all sorts of bad stuff was happening. There were weird complications, and patients weren't doing well. Because that's not me. We had to put a team together in the operating room, on the floor, the physician extenders, how we do the ICU, everything from the beginning. And over time, we've been successful. But it was very humbling. As you get older, your ego gets less. It's sort of now, and I got to tell you, if you look at our president, it doesn't apply to everyone. However, if you are a physician and not a politician, and you have your patient's interests at heart, which is where they should be, no matter how ambitious you are in your life, I think this fraction is what you need to remember. And that if you really buy into this, the success is yours. It's almost guaranteed. By not buying into it, you won't get there. You may get there in your mind, but you won't get there. And I think that in the end, I think there are really specific things to have success. You can ask a lot of people what success is. And success is in the eyes of the beholder. Was Donald Trump successful? I mean, I don't know. But as a surgeon, to be successful, you need these things. You need to be humble, you need to be innovative, Don't be afraid to be with people who are smarter than you are. You know, it's okay. People can be smarter than you. Know your competence, where you are in the competence curve, because then you know you have to work. Enjoy the process. You're never done. I remember saying, oh, I'm done. I'm going to finish medical school next week. I'm done. Then you're in your residency. Oh, I'm done my residency. I got to go. Then you have your job. And then, oh, I want to become a professor. Oh, I did that. There's always something. You're never really done. There's always, and just embrace that. That's okay. That's why it's okay to, I tell my kids, it's okay to take a year off. You know, you're not, so what? You work an extra year when you're 75 or 74. It's, you know, open your mind to that. You know, it's not necessarily for everybody. There are other concerns, whether it's your family, financial issues. But just respect the fact this is a journey. It's never really over, and you're never really done. Listen to your patients. You know, your patients are pretty right on, and they tell you everything you need to know. So you have to listen to them. And as far as balance goes, we all strive to be good parents, good children, good siblings. We all try to. Balance is you have to do it every day. There's not a day that doesn't go by, and I'm here. You know, my daughter's at home. I FaceTime her. I miss her. But then I got to go to a great show with my niece who's here studying abroad. So, you know, there's always a balance, and you have to do the best you can. We're just human beings. We're not perfect. And remember grit flow mindfulness, that you need to be strong and gritful, try to get that flow curve, and be empathetic and mindful. Have self-awareness. And I think you do that, you'll be fine. So these are my two families. And I think that in the end, this is why we live. We have our family at work, who we strive to be with, and then we have our family at home. And balancing those two things is life's greatest challenge. And it's not always easy. It's not, no one's perfect. But I think if you take this on and take this challenge, it's a great life. So that's it. Thank you.